My pleasure to present the study, the cost-effective study that was conducted from 2004 to 2007 in France. And unfortunately, Professor Trancard is not here, and he was the principal investigator of that study, and we were just part of in the design of the study as a center. So this study was a little bit special because it was sponsored by the French Ministry of Health, and that was in the Therapeutic Innovative Cost Program, and was designed for evaluation of the economical impact of CEUS. That was a prospective multicentric study without individual benefit involving 15 centers, and a total of 878 patients were enrolled. So the main objective was a medico-economical evaluation of CEUS for the character. The main medical criteria was the diagnostic value of CEUS, and we also had a blinded evaluation of all CEUS examination, and in the second period, evaluation, also blinded evaluation of MRI and CT. The endpoint was the evaluation of the diagnostic value of CEUS, reviewed by the experts in a blinded review process, and 4 reviewers were analyzing all the clips, all the loops. And basically this was correlated to MRI or CT scan, and there was a MRI and CT review by a specific committee, and to the biopsy when the biopsy was done as a gold standard. So basically, 878 patients were enrolled, and finally 874 patients were kept. 730 patients had only 1 nodule, 128 patients 2 nodules, and 16 patients with 3 nodules. So a total of more than 1,000 lesions, focal liver lesions, were studied in this evaluation. The mean diameter of the focal liver lesion was almost 3 centimeters, and the skin to lesion was almost 6 centimeters, and the average volume injected was 3.1 milliliter of Sonoview. So going to the cost evaluation or the pharmacoeconomical evaluation, the data were collected from 6 centers, and as you can see, this is minimal and maximal room occupation for ultrasound, smaller, of course, to the CT one and to the MR one. The cost for CEUS is based on the price of the ultrasound machine equipped with the specific softwares for contrast-enhanced ultrasound, between 130,000 to 190,000 euros. And the CT scan, of course, was more expensive and below the MRI scan. The examination duration and contrast volume were also evaluated. So the examination duration for MRI was in between 30 to 40 minutes. For a CT scan, it was in between 15 to 20 minutes. And for CEUS, it was for 15 to 25 minutes. But I should add that we discussed very much that time, because that was not the time for the CEUS evaluation, of course. That was the time of the conventional baseline examination as a total evaluation, and then adding the CEUS. So it's the complete ultrasound examination, not the CEUS one. Of course, then you must take into account the time the physician was involved in the examination for each of the three modalities, as well as the number of technicians and the time for the technicians to be involved in the evaluation. So for contrast ultrasound, the average for both the physician and the technician involved was 47 minutes. The average was 67 minutes for CT scan and 79 minutes for the MRI study. So if we can summarize the picture for CEUS, basically the area of the room for CEUS is 2 to 3 times below the room for CT or MRI. The investment is at least 5 to 8 times below. The time spent is slightly greater than CT, but because we took into account the overall time for the evaluation, not only the CEUS time, but was still lower than for MRI study, the time spent for medical and non-medical staff was lower for CEUS. So this is bringing some data for the pharmacoeconomical evaluation. In the second step, we try to evaluate the cost, the global cost of the evaluation, taking into account the cost for the sonoview, the cost for the iodinated contrast agent, and the cost for the gadolinium chelate contrast agent. And all of these costs, if we search for the data in the overall book in France, and we just took the data. If you go to the pharmacy and then get the contrast agent, this is not the hospital price contrast agent. Then we calculated the cost of the minute of the physician, the operator, the nurse, and the healthcare assistant, if you had one, and then the cost for the machine and maintenance of the machine. And you have here the data with the almost 14 euros for the ultrasound examination, almost 40 euros for the CT scan, and almost 80 euros for the MR study. So basically, then if we add all of these costs, and I'm sorry because this looked like a little bit boring, but if you add all of these costs, the CEUS with contrast, physician time, the operator time, and in the nurse time, the machine cost, and then you reaching a total cost per examination that is around 144 euros per examination. For the CT scan, you see that the data are different. It's almost 180 euros, and for the MRI, it's almost 220 euros. So the CEUS, despite the cost of the ultrasound contrast agent, is significantly below the MRI cost and the MR and the CT cost. For the minimum to maximum cost, we try to get the lowest value and the highest value for involving the timing involving the physician and the operator, you see that still, if you take into account the minimum to maximum values, the CEUS is much below CT scan and an MRI. So basically, the direct cost per patient is between 140 to 160 euros for CEUS, compared to 170 to 190, almost 200 euros for the CT scan, and 200 to 240 euros for MRI. So clearly, CEUS appear more economical compared to CT scan and MRI. When we look at the reimbursement that is provided by the social security system in France, this is the reimbursement of the ultrasound examination. This is cost that we can add for the examination, and then that's the cost for the sonoview. So basically, the cost for the healthcare system is about 175 euros. So you can see that there's no specific different reimbursement for CEUS compared to a conventional ultrasound examination. For the CT scan, we reach the number of 260 euros, and for MRI to 380 euros. So giving an overview of putting these numbers together, we had a total of 77 nodules analyzed in these 6 centers with 120 discordant diagnoses. We assume that one CT scan and MRI were providing 100% characterization, which, you know, that's not the case. And we just took the characterization level of CEUS that was given in the study of about 80%. And we had this malignant and benign lesion. This is in accordance. This is concordant nodules. So basically, if the CT scan and MRI study provided the 100% characterization, the cost for the characterization of this nodule is about 179 euro if we're only doing CT scan or MRI. So if we want to take into account the 80% characterization level, you can see that the cost per nodule for CEUS now is getting up to 171 euro, just because our characterization performance is not 100%. I think that this slide is the most important of the talk. We chose the accuracy of 80% and take for 100%, 100 patients in euros. So the cost of ultrasound without CEUS, because it's always starting with an ultrasound examination. And then we have the cost for the CT scan and the MRI, and we assume that 50% were studied with the CT scan, 50% with MRI. And so the total cost for the 100 patient would be about 40,000 euros. Now, if we taking into account the arrival or the use of contrast-enhanced ultrasound, of course, the upfront cost of ultrasound is increasing due to the injection and the use of the sonoview. But at the same time, I would say that the CT and MRI cost is reduced very significantly. So basically, for these 100 patients with an accuracy of 80%, we're still saving about 16,000 euros. So I think this is very significant and very interesting. And when we move to the patient that underwent the saving of US, of course, the performance of the technique is critical, and I would like to say a few words about the concordance or discordance, because the analysis of these concordance is critical in such a study. If we chose just to review the cases and split between cirrhotic livers and normal livers, you can see that there's a significant difference both in the kappa values and almost in the concordance rate, because we know that cirrhotic livers are more difficult to study, even using ultrasound contrast agents. And this is a case of HCC with a concordant result between the contrast-enhanced examination and the MRI study. This is a discordant result due to the strong hyposignal during the late phase that make these lesions considered to be a metastasis instead of HCC, while it was a clear HCC at the biopsy. So concordance result of CEUS versus the reference can also be split with the size of the nodule. And you can see that when we're studying smaller lesions below 2 cm compared to lesions above 2 cm, there's almost no difference with the kappa value, or almost at the level of a significance, while the concordance rate was significant. And that's also interesting that there's a difference in studying small lesions compared to bigger lesions. And then taking the overall data for CEUS, you see that the kappa value was 0.70. That's pretty good, with a concordance rate, overall concordance rate of 84%. In fact, when we deeply analyzed the discordant results, we found that 78 cases with discordant results had to be reviewed by the specific review committee to get the final consensus of CEUS and reference method. And the final results, final diagnosis was obtained after the review of the entire examination set and the biopsies and follow-up. This slide, I think, is also a critical slide. If we just try to split between benign and malignant lesions, CEUS on-site versus reference, I mean CT or MRI on-site, had 12 discordant diagnoses. If we take if we analyze the results of CEUS on-site versus the review, the blinded review CEUS, we had 21 discordant diagnoses. But I think the last line is even more important. If we analyze the reference CT or MRI on-site analysis versus the review of the MRI and CT, then we had 37 discordant diagnoses. So I mean that the discordance in the MR and CT group for the reference, as a reference examination, had some significant impact in the study. We also designed the study in 2004, and at that time, the quality of the ultrasound and the contrast-enhanced ultrasound was significantly below than right now. And among all the examination, 34 exams were done without split screen, and I think none of us will use that technique right now, just because it was not yet available. 80 patients had a severe steatosis, and 22 examinations were considered of limited or poor quality. So basically, in this group, 24 ultrasound diagnoses were changed, while 22 among the 78 ultrasound examinations were considered of limited or poor quality, and in that group, 7 diagnoses were changed. So you see there's a major impact of the ultrasound image quality on the performance of the technique, and obviously on the agreement between the contrast-enhanced examination and the reference examination. In the gold standard review, 4 among the 78 MRI or CT examinations were considered as limited or poor quality, and 2 biopsies were rejected, and I think this is also interesting, as gold standard, as both the CEUS and reference imaging were of good quality and concordant. So the biopsy was maybe done, not exactly done at the site of the tumor, and in that group, 25 diagnoses were changed. So this is an example of a misdiagnosis of a lesion considered to be a metastasis at a CEUS and considered to be HCC at the CT examination, but biopsy confirmed that was a metastasis, of course. So basically, the take-home messages are as follows. This large multicentric study confirmed the very strong improvement in the characterization of focal liver lesions by using CEUS. The changes in diagnosis from the blinded review result from both the CEUS and reference imaging misdiagnosis was really significant, and there's a necessity to get the true diagnosis as much as possible by using oral surgery or the biopsy. But you saw that even biopsy is not a perfect gold standard. The blind review process finally from an economical point of view, the economical evaluation is in favor of a significant cost saving, whatever the situation was considered, global cost, reference or nomenclature, and time. And so cost saving were also observed for CEUS in the biopsy group. Thank you very much for your attention.